To explore posterior teeth, we first need to find the correct working end. The correct working end, the lower shank, will be parallel to the long axis of the tooth. This is the correct working end. For exploration, we always begin at the distal line angle, pointing the tip of the explorer distally. You want to make sure always that the tip of the instrument meeting the last 1 to 2 millimeters of the side of the explorer is against the tooth. We start at the distal line angle, light pressure, light grasp, and we work halfway across the distal surface. On a posterior tooth like a molar, it's a wide tooth, and to know that you're far enough interproximal, you should bury from the last bend to the end of the instrument. Sometimes I see students out here that think they're as far as they need to go interproximal, and it's not quite far enough. So when you're finished with the interproximal surfaces on a molar tooth, you should be all the way in. Then you're going to reinsert. You're going to turn the explorer so it's now pointed mesially. You're going to begin behind the distal line angle so that you make sure to evaluate the line angle, and you complete oblique strokes across the straight buccal. You need to be rather up on your fulcrum. If you're flat on your fulcrum, then the explorer tip will be pointed towards the junctional epithelium, which is incorrect. So by coming up on your fulcrum, you have oblique strokes. When you get to the mesial, you're going to find you've run out of room, you've turned as far as you can, and you still need to turn quite a bit further. So sometimes I'll say, come off the tooth, turn the instrument, and then reposition at the line angle and continue your strokes towards the mesial. Again, you need to come halfway across that mesial surface to be far enough interproximal. You'll come out, reinsert, distal line angle, work halfway across. You can have wrist motion activation here, but really light pressure, light grasp, so that you get the tactile sensitivity that you need to feel if there's calculus. On this straight buccal surface, I know I'm on the tip because the back of the instrument is away from the tooth. If this is flat like this, I know the tip is off the tooth because the back is on. So you can look at the back of the instrument as a visual to know that you are far enough on the tip. So again here, I know the tip's on the tooth because the back is away. The instrument's like this, the tip is off. So you need to roll generally a lot further than you think to be adapted. Starting distal line angle, halfway across, reinsert, oblique strokes. You're going to hear roll, roll, roll. If you hear that, you're too flat this way. And if you're struggling, then come supragingival and look at the tip on the tooth. Anytime that tip comes off the tooth, like right there, you can see it's off, right? But it's tricky to see subgingival. So come supra if you're struggling, so that you can see that the tip stays on the tooth. Generally, it takes more rolling, more adaptation than you originally think, especially on the interproximal surfaces. So there you can see back away, tip is on, back's on, tip is off. Remember that you need to do horizontal strokes. We do horizontal strokes on the line angles. We start behind the distal line angle, cover the line angle, and continue the stroke maybe a millimeter or two beyond the line angle. We do distal and mesial line angles.